Welcome to Alzheimer's Sunrise, lighting the way for patients and caregivers on Legends 100.3, brought to you by Alzheimer's Community Care, providing help and hope for thousands of families for the past 20 years. Here's Mary Barnes, CEO of Alzheimer's Community Care.
Welcome to Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. We're here today with Karen Gilbert, and she's my co-host, and we're just our partner in crime here. You can call Alzheimer's Community Care at 561-683-2700 or send us an email about how you feel about this radio show this morning and what we say and how important it is to your life. And that's at alzcare.org, alzcare.org. Karen, we've got a special guest.
Yes,
one of your favorite people.
Yes.
And I'm going to have you introduce her, and you'll become everybody's favorite too after you're through with this.
We are
show.
so thrilled to welcome Dr. Joanne Masella. Dr. Masella is the Dean of the School of Nursing at Palm Beach Atlantic University, a very, very important partner with Alzheimer's Community Care. And we've been working together for quite some time. Thank you so much for being with us this morning.
Welcome.
And we have a lot to talk about with Palm Beach Atlantic and the School of Nursing. And you have been with Palm Beach Atlantic for
11 years this year.
11 years. Outstanding. Tell us, if you will, a little bit about the background of the School of Nursing.
Okay. Palm Beach Atlantic University, nestled right in downtown West Palm, on Okeechobee and Flagler, if you haven't found us. It's going to be 50 years old next year, so pretty young for a university, actually.
It is.
The School of Nursing is just going to be graduating our Class 11 this Saturday, pinning tomorrow night, graduation on Saturday, which will already have occurred by the time this airs.
And I'm looking forward to it. It is a beautiful event. The pinning ceremony for the nursing graduates it's really a privilege to be there.
Alzheimer's Community Care has strong relationships with Palm Beach Atlantic. One of our real greatest supporters who helped us even get established was the Baxter Foundation.
Okay.
And the Baxter Foundation.
Baxter Hall.
That's Baxter Hall.
Baxter
a nice
Hall.
big, and have supported a lot of the work and of the growing of Palm Beach Atlantic over the years. So we have that bond between us as well.
Yes.
And I will say I am thrilled to currently be a student.
Yes.
And we'll talk about this. I am in one of the School of Nursing programs that we'll ask Dr. Masella to tell us about. But I remember being incredibly impressed the first time I stepped on the campus, actually for an advisory board meeting. You've had me involved with the advisory board, another honor, for several years now, and it is just a magnificent campus and just a wonderful environment for learning, not only physical appearance, but the feel and the culture of the university.
Yes, you can feel the love as soon as you step on campus.
Absolutely. It is exceptional. Tell us how first the undergraduate nursing program has developed and grown.
Okay. First graduating class was in 2007, and there was 20-something, I think 22 people roughly at that time. I came to PBA in January of 2008. We now have Class 11 graduating this week with 57 graduates.
That's impressive.
And we take now roughly 60 students each fall, and next fall we're going to 80. So we'll be taking 80 students next fall. And I was sharing with Mary and Karen here that I'm a little scared. It's a lot of people.
But you know, our world needs them so badly.
And we know that.
The healthcare system without the nurses is...
The nursing shortage that's predicted is fairly stunning, and we have an aging population. And one of the challenges is that schools are being pressed to increase class size.
Yes.
And that's a major challenge when you're taking 20 or so more students than were in last
We've
fall's
increased
class.
by 25% just in 1 year. So and we don't have 25% more human resources nor physical space. So our faculty are really committed to doing a great job and taking in the newbies.
They are, and it's not just a challenge for Palm Beach Atlantic. That's a challenge for every nursing school.
Yes, it is.
So we're thrilled, and I'm also privileged to come in and do classroom training with the undergraduate students before they actually visit our day centers, so that they understand the theory behind what we are able to accomplish with therapeutic care in the day centers. And now I have to come twice because there'll be 2 classes, because it's grown so much. We're separating into 2 groups.
I know.
So tell
But I
us.
have to say, Karen, that the students that we have seen on their evaluations have been outstanding. And so we know that the ability, that the vision that you have all had to share the experience with knowing about Alzheimer's has really benefited in so many levels.
It's not really pervasive in undergraduate education, this distinction of Alzheimer's and the other neurocognitive disorders. And Palm Beach Atlantic has really invested
Yes.
in having these students graduate understanding far more about how these diseases will impact their patients that they see. We'll be back in just a moment. This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. You can call us at Alzheimer's Community Care at 561-683-2700. You can send us questions or comments to info@alzcare.org, ALZCARE.org. And if you do, please tell us you heard us on Legends Radio. Please visit our website, also alzcare.org, where you can listen to any past shows that we have presented as well, and also see a tremendous amount of information on services and resources available for patients and families. So what we'd like to address as well is the graduate program, and how has that developed?
The graduate program, as you know, Karen, since you're in the program, we graduated the first class December 2017. That was a process that took about 5 years to get a program approved, and then 3 years of the program. So it's been a long journey for us, but it's been amazing. The first 18 graduates that graduated last December have all gone forward to pass certification exams. The certification pass rate was 94% for the first class, very much higher than the national average. So Dr. Morgan, Dr. Koretsky, very proud of that group. About a year in, we started just with a family nurse practitioner track initially because that was what the consumer was clamoring for, was family nurse practitioner. About a year in, we decided to start looking at a non-clinical track for those that never really wanted to be nurse practitioners, but that wanted to be administrators, wanted to be educators. We are an aging faculty population, so we definitely need to be replaced. And we're looking for a succession order, so we're training our successors, we hope. So the executive leadership track was born. So we now have 2 tracks. And we are hoping for our 3rd track that we're going to have psychiatric nurse practitioner. We have talked about that previously. The only reason we don't have it yet is we don't have a faculty member to teach it. There is such a shortage of people for that. So
It's a difficult specialty.
There's something that we know
Very
that
badly needed, though.
Very badly needed.
and we have
That's
a
wonderful.
professor now who is she's studying for nurse practitioner. She just finished her PhD, Professor Jarambi, and she is starting courses for psych nurse practitioner now because it is her desire to go into that track. So that will happen. I'm not sure when. But you've taken the patho class.
No,
Okay,
no,
you
because
didn't
I'm
take
not a
patho.
clinician.
All right. Well, in the
I'm taking that
but in the
leadership
patho
track.
class, that is specifically when we talk about the neurocognitive
Yes.
pathologies, and we talk about them very separate and distinctive from mental illness. Okay, because often they are confused with mental illness, and we know that.
Absolutely.
So we
that's-
talk about the normal and the abnormal symptoms.
I'm
with
so
the
glad to
students.
hear that, because in the medical field, and doctors even have confused the two.
Yes.
And it's good to hear that distinction is being made. It's been a lifelong, how shall I say, I don't want to say a fight of mine, but it's been very, very hard to going out, trying to explain the difference in the hospitals, in the treatment centers,
Yes.
and all that. We've had to fight for that because it is a disease process.
Yes.
And it does go through stages. And it's so glad to hear that specialty, that's being looked at in that frame.
Our graduates definitely know that, both undergrad and graduate.
It's very good to hear.
Yes, they do, and they're really starting out. The undergraduate nurses get to start their career in nursing with a much greater understanding of that, which is really an advantage. No matter what age group they work with, they will encounter patients or family members of patients that have some type of neurocognitive disorder.
Yes.
And it's very important for them to be able to recognize those signs and be able to intervene appropriately.
By 2030 in Florida, 25% of that population in Florida is going to be over the age of 65. So I'm not saying just because you age, you're automatically going to get Alzheimer's, but because you age, you are at a higher risk of getting some sort of neurocognitive disorders. Yes. And we love the word neurocognitive disorders because it gives a fairer description. Alzheimer's is not the umbrella. Dementia is not the umbrella because dementia is the science, but saying neurocognitive disorder puts everything in perspective.
Yes. And hopefully our students will know, and the nurses that come out of this program will know how to distinguish that from classic mental illness. And we hope to change the rules basically in the practice world to educate others.
Well, I applaud you.
You know, the nurses are going to be the first in there to educate the rest of the healthcare team.
That's right. We need these advocates. I've had the privilege to serve as preceptor, I believe, for 10 other doctoral students, and the projects they have focused on and the intensity of the research and what they have done with that information. They've become new advocates. They will be mentors for their colleagues who may not have had the preparation that they have had when they get out in the field. One example was one of our recent heroes in medicine, doctoral student Alexandria Watkins, who really captured this notion of needing a way to screen for cognitive impairment. Yes. And it wasn't her field. She's been a nurse for several years, but that was not her specialty. But she developed this incredible passion for this as a staggering need in our healthcare system. Identifying cognitive issues early, intervening appropriately, applying a standard of care. Palm Beach Atlantic was also recognized with the Palm Beach County Heroes in Medicine Award. We'll be back in just a moment to talk a little bit about that. This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM.
Serious progressive illness means it's time for hospice. Count on VITAS Healthcare. We're always available, middle of the night or holiday weekend. Available to address pain and other symptoms. Available to improve quality of life. Available to the family. Available right now. Call 888-VITAS-80 or go to vitas.com. That's VITAS.com. First licensed in 1980.
If you or someone you love has Alzheimer's disease, please listen carefully. Right now, Palm Beach Neurological Center is seeking individuals diagnosed with Alzheimer's disease to participate at no charge in a medical research study of a new investigational drug. To participate in this study, the patient must be taking either Namzaric or Aricept plus Namenda or their generics. Participants must have a partner or caregiver willing to assist during the study. Our study involves 6 clinic visits over a period of up to 34 weeks, and compensation may be available to qualified participants. For more information, please call 561-282-5546.
Welcome back to Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio. You can call us at Alzheimer's Community Care at 561-683-2700. You can email your questions or comments to info@alzcare.org, ALZCARE.org. And if you do, please tell us you heard us on Legends Radio. Dr. Masella, the DNP program, the Doctor of Nursing Practice, this is a fairly new degree, is it not?
Yes, it is. It's only several years that's been established in the nursing world. Doctor of Nursing Practice is, as it says, practice-focused, as opposed to the PhD, which is research-focused. And it's the highest level of preparation for nursing practice.
That's important because these graduates will have the title doctor.
Yes, they will.
And there is a risk that their identity can be misunderstood. So one of the things we want to distinguish is how does this nurse practitioner avoid that confusion and distinguish from the internist or the cardiologist or the orthopedic surgeon?
We tell our graduates, when you're with your patients, you tell your patients, I'm your nurse practitioner today, because we don't want them to be confused with physician. We don't want them to be the physician. We want them to be the nurse practitioner. So for the mostly elderly geriatric population they're working with in Palm Beach County, it's important that they tell them, I am your nurse practitioner. And sometimes a patient will ask, what is that? And then they'll be able to discuss it. That's a registered nurse who went on for advanced practice training and advanced scholarship and learning more about the profession. In this program for doctorate in nursing practice, we talk about healthcare policy, advocacy, legal, ethical aspects, and much emphasis on scholarship and scholarly projects, which is the culmination of the program. So it's been quite, for me, quite interesting to see that the first group of projects that the students did, some of which Karen has referenced here as she has worked with these students, and she'll soon have a project of her own.
Yes, yes, and so much support from the faculty and from you that it's just a privilege to work on these projects. And as I said, I have been incredibly impressed with the depth that the students are exploring these different issues and presenting their projects.
And see them get implemented.
Yes,
There was 2 of them that were
yes.
implemented immediately after graduation.
Outstanding.
So the introduction of this level of nursing into it's sort of like is it a bridge or is it a layer between the medication, the medical, the clinical, and the practicing?
I wouldn't call it a bridge. It is very much just advanced preparation. It's a registered nurse that decides to go for more advanced preparation in all areas of leadership, scholarship, and practice modality.
So in the field of treatment, though, and looking at as being part of the care plan, so to speak, for the patient and the introduction of that into the plans, into the practicing system. You know where I'm going with this?
Yes.
So that is the addition of, or where we are with medicine. It's going into another type of application, so to speak. Am I right or wrong?
Well, yeah,
You know what I'm trying
Yes.
to say
Yes.
here?
Yes,
Okay.
and it can
Just to
vary
explain
state
that.
by state because different
It does.
states, and we do have many residents in our listening area that do travel, so they may find different rules applied in different states as to the scope of practice of a nurse practitioner. Now, you could argue, why is it not standard across the country? Because the needs of patients are pretty much standard across the country. But that is something we deal with, and hopefully a barrier that we will overcome. I think it's really important for people to understand that that term doctor applies to someone who's achieved the highest level of education in any field. It could be in the field of law. It could be in psychology.
Our pharmacy
Or
students, our
pharmacy,
graduates
physical
are now
therapy.
called doctors.
Yes, occupational therapists may earn that degree as well, and that your internal medicine practitioner or your orthopedic surgeon, they are physicians.
That is correct.
So, the nurses who have worked so hard to earn that distinction, it is important to note that that is an appropriate title, Doctor of Nursing Practice, and does represent that they've achieved that highest level of education available to nursing.
So we get that in with the patients.
Yes.
We tell them how well prepared your nurse is. Here's your nurse practitioner today. And then if someone says, well, what is that? What is a nurse practitioner? We tell them it's a registered nurse that has gone further on to get graduate degrees in nursing, master's degree, and doctoral level degree to further their scope of practice.
I think that nursing has always been highly regarded since Florence Nightingale. Highly regarded.
Love Florence.
As an instrument of wellness. Of
Yes,
that. I mean, when you
yes.
think of Sister
Yes.
Kenny out there in
Yes.
the bush.
Yes, with
when
community
she was the
nursing,
nurse,
that's
and how
right.
she added so much to the polio
Yes.
for that whole, with her special approach, which was different and in denial for a very long time, because my father had polio when he was small. And so, and Meme,
We have a family member, a favorite aunt of ours that had polio.
Yeah.
So we learned
But
a
to
lot.
apply
We
that
learned a
Sister
lot about
Kenny treatment.
polio. Yes.
and wasn't really recognized for an awful long time.
Remember
But
the
that's
little
kept him
little
walking.
pink the little pink syrup that we had to
Oh,
take?
yes, in school,
the polio
yes.
vaccine.
They put it on a sugar cube, as I
They
recall.
put it on a sugar
And
cube. I
because-
remember as a kid being lined up for that.
And
Exactly. In
because
school.
of that nursing, she was able to solve that and come up with that treatment,
Yes.
different from what the doctors were saying at the time.
Yes.
This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. You can call Alzheimer's Community Care at 561-683-2525. 2700, or send your emailed question or comment to info@alzcare.org, ALZCARE.org. I did want to come back for a moment. We talked about one of our doctoral students who was honored by the Palm Beach County Medical
Alexandra.
Society with a Hero in Medicine Award, but also Palm Beach Atlantic was recognized as well in another category. Can you tell us a little bit about that?
In the category of community organization. The university was recognized for community involvement. The examples that were given was the Volunteer Nurse Corps,
Yes.
that nursing pretty much is in charge of. Yes, we run. Dr. Morgan is the faculty member that facilitates that. That began with a grant from the Palm Healthcare Foundation and continues into year 4 now with the Palm Healthcare Foundation. So we're very grateful to them for the financing that they give us to allow that to move forward. We have a full-time director in that program, Dr. Fontaine Timmer, who graduated from our DNP program.
Yes, first class. Yes.
And that group gets out there. What they do, they are, just as the title says, volunteer nurses. They're out there in the community visiting clinics, doing community health fairs, and we are gradually moving that more into, we hope, more home care for the future, because that's where we see the care out there in the community, not in facilities.
You're talking. You were preaching the same thing. Let me tell you, we CDC. I don't know if you saw that report that they did just not too long ago.
We talked about that.
You know, since 2000 to 2014, they have seen an increase in Alzheimer's patients dying in the home by 89%.
Karen and I were discussing that.
And this is the focus. First of all, it's what patients and families want.
Yes.
These patients, particularly those with Alzheimer's and related neurocognitive disorders, do not do well in the acute care setting for a variety of reasons. For one, that their cognitive status is not well understood. So in the acute care setting, they do not understand that this is a person that is not going to ring the bell when they need help, because they frankly may not remember they have a bell.
That's right.
They just know that they need something, and they try to get up to meet that need, and they often
Because you took them
fall.
out of their familiar environment.
Absolutely.
You took them out of their bed, you took their clothes, you took their food,
Absolutely.
you took their everything.
And then
then we say they're non-compliant.
Exactly.
I love that word.
And if they get agitated, they often get medicated.
we just sedate them.
Exactly. So it's and it's not because any acute care setting intends to do the wrong thing. It's this lack of knowledge that's out there. Another reason we are so thrilled that Palm Beach Atlantic's nursing students are being prepared to know how to address those issues. So the more we can keep them out of the acute care system, out of the emergency room, the better they do.
Yes.
So this continuum of care, which is also what we advocate as a model of care, I can see the two tracks actually.
Yes, they blend very
Parallel,
nicely.
absolutely.
Yes.
Not even parallel, but a blend. You're absolutely
Yes.
right, because this is where the future is. There is just not going to be enough. There is not going to be a cure in the next 10 to 15 years. But this big bulge that we have, as far as the population goes, they deserve this community access. They deserve it, and I'm so proud of being with Palm Beach Atlantic and doing this kind of very visionary approach.
Well, these DNPs will have the proper knowledge base to get out there and help to take care of these patients in their home, teaching families how to care for the patient in the home.
There's something else very novel that Palm Beach Atlantic did, and that was the interprofessional education. And this was where the nursing students and the pharmacy students sat together and learned together, did case studies together. And that's
challenging.
Very challenging, very innovative, and they really showed a tremendous amount of insight into the needs of these patients. And working together, if a nurse goes into a home and finds a 90-year-old patient who is cognitively impaired and on 12 or more prescription medications, which these are real cases that they studied. This is not an isolated incident. They were able to work out together what those issues were and how the physician could be approached, because oftentimes less is more when it comes to medications in older patients, and particularly those with a cognitive disorder.
Yes.
So that is incredibly innovative, and we were thrilled to be invited to be part of that training as well. And it does trouble me, though, that the word interprofessional, if you type it, your word system wants to tell you you're spelling it wrong.
Yes.
And so we need this recognition.
Spell
that
check doesn't recognize
exactly.
it. Yes.
Interprofessional is not only a word that we need, but one that will have more and more importance as we continue to be an aging population, have, as Mary said, a much greater percentage of those over 65. Age and genetics are the two unmodifiable risks for Alzheimer's, and so we will see more.
And having the institutionalization of the specialized Alzheimer's daycare available in every community is so critical.
And
for
it's a
all
model
that
that works. We know with 22 years of history that those that engage in therapeutic specialized adult day centers are able to remain at home.
Right.
Fewer than 1 in 5 of our day center attendees ever move into a nursing home.
Right.
And if we can get the professions to work together, this is going to be so much
is the
a finer model of care
Exactly.
for these individuals. It's been interesting. This has been about 3 years we've been working with the pharmacy students, and throughout the year they have classes together. And it began initially because it was a part of accreditation. It was something that was required to be done, and now it's become something that we enjoy doing, and we see how this benefits so much. How the professions work together. And after the first, we did a simulation just a few weeks ago in our sim lab with a pharmacy student and a nursing student. And the pharmacy student came out and said what a great respect he had for nursing, that he had no idea what nurses really did.
Wow.
So this is just only going to improve the quality of healthcare in every area.
And it takes all of us. No
Absolutely.
single
But
profession.
to be open to that and to have that kind of visionary, as Palm Beach Atlantic has done, is a compliment, and they do deserve that community award. That's for sure. Because
And that was a big piece. Nursing, pharmacy, and our counseling department also was part of that. The counseling program
Takes
is
all of
one
us.
of the largest programs at the university. So it's mind, body, spirit that we educate for.
Well, together we're going to continue to make this especially difference when it comes to the work that we're doing with all neurocognitive disorders.
Yes, and it really is a privilege to continue to work with the undergraduate students and invite them into our day centers where
They love having you, Karen, when you come to
we
class.
love having them.
It's never boring when Karen comes to class.
I believe
And
that.
our program managers and program nurses will typically call at the end of a day when the students have been there and ask if they can keep them. So they are extraordinary students. It is just absolutely a thrill to be involved in their education.
Any special thoughts that you want to leave with us?
I just want to thank you for this opportunity, and I'm looking forward to many more years of working together with you, Karen, and your organization, and furthering this cause that we have to get the knowledge out there about neurocognitive disorders and help all those families that are out there that so desperately need us.
Well, we'll just keep making it happen.
And Palm Beach Atlantic University will continue to be your partner.
Thank you so much, Dr.
You are a blessing,
Masella.
Karen.
As are you and Palm Beach Atlantic and the entire faculty, amazingly supportive to these students, and that's why they succeed.
It's a great team.
That's right.
Absolutely.
It's our family, as we call it.
It
sure
really
is.
is a family.
It sure is.
Thank you so much. This is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. You can reach us at Alzheimer's Community Care at 561-683-2700. You can visit our website at alzcare.org, ALZCARE.org. Tremendous amount of information on our website, and also past recordings that you can listen to from our Legends Radio shows. If you do call us or email, please tell us that you heard us on Legends Radio, and our email address is info@alzcare.org. Again, ALZCARE.org. Thank you so very much.
Yes, this was wonderful.
Thanks for listening to Alzheimer's Sunrise, lighting the way for patients and caregivers. To learn more about the help and hope available from Alzheimer's Community Care, call 561-683-2700 or visit alzcare.org. That's ALZcare.org. Tune in next Sunday at 6:30 for another edition of Alzheimer's Sunrise, lighting the way for patients and caregivers right here on Legends 100.3.